bringing you information based in fact and science concerning today's marijuana. I'm your host, Chris Wolf, and this is Perspectives. With us today is a subject matter expert from the National Marijuana Initiative, sharing their perspective on the influence that today's more potent forms of marijuana products are having, both in our society and in their field of expertise. Welcome, Dr. Roneet. How are you?
Great, thank you. Great to be here with you too.
Let's start by talking a little bit about cannabis hyperemesis syndrome. What exactly is that, and what causes that?
So cannabis hyperemesis syndrome is a very common diagnosis in the emergency department. The cause of cannabis hyperemesis syndrome is due to the overdose or overwhelming on the cannabinoid receptors by THC. And when they're inundated like that, the electrical wires that connect information get short-circuited and cause the opposite effect. We've seen that with opioids during the peak of the opioid epidemic, where people are getting pain medications, and instead of getting pain relief, they're getting more pain. Again, because they were getting so many opioids over a long period of time, the electric wiring short circuits and gives you the opposite, or what we call idiosyncratic effect. And the same thing now we're seeing with marijuana products, THC, that's causing opposite and terrible effects.
Now, you've coined a very interesting phrase called scromating. Talk about what scromating is and what is the cause of scromating.
So scromating is one of the greatest things I've ever done, because it allows me to connect with patients. If I say you have cannabis hyperemesis syndrome, people can't pronounce it, and they say you don't know what you're talking about. But if I say, look at you, you're scromating, which stands for screaming and vomiting, then my patients think about that and more likely to connect and realize that they have a problem.
Have people actually died from cannabis hyperemesis syndrome?
Unfortunately, yes. We've had patients who've died from cannabis hyperemesis syndrome. When you are vomiting a lot, you're losing electrolytes. That electrolyte imbalance can result in death when it's severe.
Is there a cure?
There is a cure for cannabis hyperemesis syndrome, and the cure is stopping to use marijuana. It sounds simple, but people who have an addiction, we know that addiction is a chronic, relapsing disease of the brain, and it's a lot easier said than done.
Now, you've also worked for many years in the emergency department at a hospital, and I believe you've actually witnessed and seen many marijuana poisonings. Talk about that.
So, Chris, every day, every shift I go into the emergency department, I still do that on a regular basis. I take care of marijuana poisonings every single day, every single shift, and in a variety type of forms.
What are the causes of marijuana poisoning, and is it more than just the high potency THC, the chemical that actually makes people high?
So the reason we're seeing so many poisonings is because of the high potency product. What we're seeing in the emergency department varies. We're seeing cardiac effects of heart attacks, strokes, internal bleeding from drug interactions. And the most common problem that we're seeing is cannabis-induced psychosis, which is really flooding the emergency departments with patients with various mental health problems.
And the biggest killer that you've seen is the drug fentanyl. And I believe you wrote a very interesting comment where you said you've never met anybody who used marijuana who didn't start with, anybody who didn't use fentanyl who didn't start with marijuana, correct?
That's true. We know that the drug crisis in the United States it's the worst that we've ever had in a country. We're losing a whole airplane a day of people to drugs who are dying of preventable deaths. And the driver of that is fentanyl. And of all the patients I've treated who use fentanyl or overdose from fentanyl, who are lucky to actually come to the emergency department, I have not met a single patient who uses fentanyl or overdose from fentanyl. They didn't start their journey with marijuana, starting to prime their brain at a young age with drugs.
Now here's a question, fact or fiction? Medical marijuana can actually help with seizures?
So that one is clearly false. And the reason that's an important question is I see patients coming in the emergency department having seizures, and they say that, well, they use marijuana to help with seizures, and that's a very problematic health misnomer. There is Epidiolex, which is approved by the FDA to treat pediatric seizures, very, very rare seizures in babies, seizures called Dravet syndrome or Lenard-Gastaut syndrome. These are babies who are being treated with CBD. These babies are not smoking pot. And CBD is one of the chemicals in cannabis that helps these babies with very rare type of seizure disorder. Actually,
Question, how about with adolescents, THC levels? Is the higher the THC level, the more likely a seizure?
that is true. We know that even low potency THC causes seizures. That is on the FDA drug label for THC. If I want to prescribe marijuana, I can. There is FDA-approved Marinol, which is a low-potent THC, and right there on the FDA drug label, it says this can cause seizures. So yes, even with low-potency THC can cause seizures, and with high-potency and synthetic marijuana like spice, we know that causes seizures.
And how about the marijuana derivatives, the edible products that typically have high levels of THC? Why are children getting so sick? And do you have any data on that?
Yeah, so we know from Poison Center data and pediatric hospitalizations that the number of kids, babies being exposed to marijuana products are going up. And significantly. And adults are using, and these products are laying around the house, and kids get into them. And they look attractive to kids. They have products such as Cheetos. They look just like Cheetos, but they're called Weedos, and kids get into that. One of my colleagues recently on Pride Day had a little gummy bears with Pride, and their child, 4-year-old, got into that and ended up in the hospital with marijuana poisoning. And it's a very common, that's the number one cause for pediatric poisonings under the age of 5 is getting into marijuana.
And how about advice for parents? What should a parent do when their child's experiencing a severe reaction?
Well, the first thing is always prevention. You should be locking up these products so kids don't get into that. You know, you lock up all sorts of things, your medications around the house, chemicals around the house. This should not be in the reach of children at all. If there is a reaction, a mild one, you're worried, you call the poison centers. But if there's any severe reaction, a kid's not acting right, not walking right, then it's time to go to the emergency department.
And let's talk a little bit about drug interactions, because whenever I go to the pharmacy, I get a tremendous amount of material warning me about interactions I may have if I'm taking other medications. Are there any drug interaction information about marijuana?
There is information on drug interactions. People can go to the website drugs.com, and look up their own prescriptions and put in cannabidiol for CBD or cannabis for THC. And there are many drug interactions. People would be surprised. There are over 500 drug interactions for CBD products and over 300 drug interactions for THC products. Some of these drug interactions can be even fatal. So if you're on a blood thinner and you take CBD or THC, that can make your blood more thin and cause bleeding.
You were an absolutely wonderful guest today. Please join us again, and thank you so much for being here today. Thank you.
That's great. Thank you, Chris. A pleasure to be here.
To learn more facts about today's marijuana and its impacts, visit the National Marijuana Initiative's website at www.thenmi.org. Thank you for joining us for this episode of Perspectives.